these areas, both attracting investment to Sweden and expanding, and actually also finding a lot of suppliers in innovation and sourcing. So I'd say China is a very exciting market to work in. I've been here since 2011 in the region, and always something exciting happening. So what we do on a daily basis, to keep it very short, it's much focus on market expansion, and I assume maybe some of you listening to this webinar are here because you want to understand a little bit what are the market opportunities, basically understand, is there a market, or there some policies that could be positive for us, what's the competitive situation and so on, and if you decide to enter, who could be potential local partners or perhaps hospitals or end customers. And we have a number of promotional initiatives that we will hear a little bit more later on from Judy and colleagues here in many areas, but life science and healthcare has been a big focus in China for a long time, and also in Hong Kong. Just very briefly again, we are in roughly 35 markets. Actually, I think it's covering more than that, 40 or so, but we have offices around 50 countries and 500 people. So a very global organization in the markets that are important to Sweden. So jumping into China then, why is China important? As many of you, of course, know, China is a huge market, but I think sometimes you cannot forget to ask yourself, how big is it actually? So if you take a step back and look at year 2000, China was only 6% of the global economy, but today it's 18% or even more actually, if you look at the last year coming out here. And maybe even more interestingly, if you look at the average growth per year, comparing, for example, China with the US, which is bigger in terms of share of the economy, it's been growing 1% per year in the US, but China is more like 8%. So of course, if you want a big market that is growing fast, I think China is, important. And also, of course, there's a lot of talk about India. Will India overtake China? What does the future look like? And I don't have the answer to that, but what you can say is that even if China grows at only 2%, which is very low compared to 5% today, it will still add the size of the Indian economy in the coming decades. So of course, the growth is very important. And if it continues at 5%, which is the current pace, it will add India, Japan, Indonesia. So China, I think, is big and here to stay. Then a lot of numbers on this slide. I'm not going to go through everything, but you hear sometimes in the news about the GDP numbers and so on. On the left side here, it's looking backwards. The pandemic was tough. Then we had a bit of a bounce back. The last Q4 numbers and also the full year numbers from last year came out at 5.2%. Last year's target was 5%, so they came out higher. And this year's target was set just the past weeks in the two sections that was here when they're planning ahead, and it will also be 5%. So that is good that they beat the target, but if you scratch a little bit under the surface, it's still some struggles. For example, CPI, the consumer price index, is only 0.7%. In Europe and in Sweden, we have perhaps more sort of inflation questions. China is more the question about deflation. So it's a very big focus on how can we attract more investments and reform the economy. And also the retail is not growing as fast as before. Before the pandemic, it was almost 9% per year. Now it's 1%. So it's a bit of a mixed picture. Just on the right, on the bottom corner, I can mention here the trade balance. China is exporting more. Once again, it was kind of a decline for a while, but has bounced up. So a lot of mixed signals and quite complicated to analyze. I will not go into detail, but if there are questions later, maybe I can answer. Then China once again. I'm not sure if all of you have been to China on the call here, but when you look at it on map, it's massive. So here you have the name of the corresponding size of the economy of the region. And the region we're talking about is down in South China here, where it says Spain. It's the Guangdong province, with Hong Kong and Macau being below that. So a massive region. So that brings me to the next slide here, the Greater Bay Area. What is that? So maybe some of you know about it, but it's basically the Guangdong province with Hong Kong and Macau, as I mentioned, a number of major cities with a population of roughly 87 million people. So of course, it's a massive potential end market, but also a very innovative and tech-driven region, also strong financially with Hong Kong and others. And if you compare it to the right side, the other Bay areas, San Francisco, Tokyo, and China, you can see that it's already bigger than the New York City economy, actually, in San Francisco Bay Area, lagging behind Tokyo. So it's a massive region that's been very strong in manufacturing. And that they're also very liberal opening up. We're going to hear more about that soon from my colleagues, but that is why I think it's a very exciting region. So I'm not going to go through everything in detail, but just kind of looking back at China, China has been changing a lot in terms of its economic structure the past year. So basically, you see in the middle here the pyramid of the different sector of the economy, the service economy on the bottom, manufacturing in the middle, and agriculture on the top, being 6.5%. That pyramid has shifted quite fast the past decades, being a quite poor country up until only 40, 50 years ago, then manufacturing really taking over. You have a lot of investments coming in, but now the shift is towards the service sector. And a lot of the focus in the recent 14th five-year plan, but also the two sections is how can we stimulate this service sector and more advanced manufacturing. And of course, healthcare, life sciences is one very interesting and high-tech area that China is also focusing a lot on. So that's kind of the background. Sometimes I feel the picture here in the news could be a bit unknown, but I would say China has very strong domestic leading companies tapping into this. Going forward a bit on a macro picture, because they always get the question, what will happen, going forward in China? What does the future look like? And I just want to give some highlights already mentioning. But if you look on the left side, it's the China's total debt ratio. So how much debt does the government have and private companies? And especially during COVID, this has grown very rapidly. There was testing every day. I was locked in myself 2.5 years here in China. So many of the local provinces have a tough financial situation, which has triggered some crackdowns, for example, in the life science area. So the question is, how can you solve this situation? So there are a few different sort of scenarios going forward. One is to continue doing what China has been doing, which is strong investments in infrastructure and real estate, but that is probably not sustainable long term. So the question is, what can you do? Then you want to shift it to more productive investments, and I will touch upon that soon. That's a lot of the focus in the recent two sessions. Or if you can increase consumption, but that is still a very low level. It's only like 47% compared to around 60 in the West. Or if you can have investments that generate exports, so increasing the trade surplus. And that you saw down on the right earlier on one of my slides. For example, automotive is one sector is going up. And that's sort of the worst case scenario that can end up in almost a bit that's what happened in Japan in the past decade is that very slow. You don't have this artificial stimulus, then the growth might go down to around 2%. So that's just kind of a macro outlook. Then if I go to the next one, so what China also is trying to do, many of you, or maybe some of you, sell to companies in China that perhaps go out, depends on kind of what sector you're in, but B2B in the Chinese supply chains. The Chinese companies are, of course, going out in the world. And what they're trying to do is to diversify the exposure from the Western mature companies. You can see on the West here, the red is the share of export to West mature markets, and increasing it to what is called the Belt and Road Initiative countries. So a strong focus on Africa, Latin America, and Central Asia, I would say. So the Chinese companies are going out. So of course, if you happen to sell to those companies, you can tap into that growth. So China is less reliant on sort of Western countries. And I just show a bit what is actually growing. So it's a bit of a complicated slide, but if you look on the vertical axis here, this is the growth rate, and the horizontal one is share of GDP. So of course, you see here, manufacturing is very big. So manufacturing is very important for China still. And if you look here, you can see that there is no healthcare or life science sector, but it's in here. So still a quite low growth rate as part of the group. The focus is on the yellow, which is more the high tech and the service sectors in terms of growth rate. But once again, it's a very small share of the economy still. So there's a big gap to catch up with the West. And then just continuing a bit on the same theme here. Up on the left four here are the traditional industries. Construction, as I mentioned, has been a strong one. Automotive manufacturing, but there's huge overcapacity in this area. So the goal is to shift on more the right side, digital technologies, and the secondary, which is the service sector, biomedicine, new energy. I'm sure all of you have heard about batteries and electric cars and so on. So China is focusing a lot of the stimulus in the economy to develop these domestic ecosystems. Then just the last little bit in the 2 sessions that I mentioned, that was just here the other weeks. So as mentioned, the target is now 5% top. Consumer price index should be 3%. As I mentioned earlier, was 0.7, so still they want to increase it by 2%. And it's kind of vague phrasings here sometimes, but to generate the new qualitative productive forces, basically developing domestic industries that are made in China and opening up to attract more foreign investments. So ending on that, I want to jump to just very shortly on Swedish companies. So of course, we get approached a lot by the Chinese different provinces want to attract investments from Sweden to China. But what you can say is this is almost 1-year-old data now. But last year, when we asked the Swedish companies in China, how do you see in the business climate? It was unfortunately the lowest score we've ever measured when we've done this. We're doing it right now, and we're analyzing the results. They will be launched on the 27th of May. So then I will happily get back with those. But you can see it's been a downward trend. It was 3.7, so the maximum was 5. 1 is the lowest the past years. So pessimistic. And while you can see here on the right side, the key reasons for being in China is because it's big and it's growing fast, but there are also challenges. Access to skilled labor, finding and retaining talent, I would say in general, IPR protection coming up, and government policies being a bit challenging for foreign companies. And we will hear a little bit more about that soon from my colleagues. Then I just wanted to mention, since we have, of course, in this forum, healthcare and life science being a big focus, it's actually the 3rd biggest segment. If you look at Swedish companies, there's a lot of things in one slide here, but on the left side, you see Sweden's total export from Sweden to China. It's the gray bar, and the blue is the sales of companies in China, which means that many of the really big companies like AstraZeneca, Volvo, and others, they have big production in China. They're very localized. They don't export it from Sweden. And that is actually 6 times bigger than the exports. So the big companies are very localized and mature. But despite that, export in life science is still very big, 57 going up to 84 here. So it's a strong segment, both for the companies that are here, but also the ones that are still exporting to China. Just wanted to end a little bit on this slide. So there are, of course, many areas of opportunity in China. Obviously, one is healthcare and life science. We're going to hear a little bit more about the macro drivers. But as you know, China has had a one-child policy for a long time. It's the population has peaked, and now more are getting elderly. And Judy will talk a little bit more about that. But that, of course, means that there is a future big need from the Chinese government to make sure that you have a good healthcare system in place. So in the middle here, of course, Sweden is very strong in this area. So it's positive to see so many listening in here. But also I want to mention that on the right side, maybe it's not relevant for all of you, but the innovation, which is strong in South China, Greater Bay Area, Shenzhen, but also the supply chain for production, depending on what kind of product you have, are very big areas that we see a lot of interest and questions from Swedish companies to actually come to China and look for what are leading innovations, either to bring back to perhaps Europe or to collaborate in different ways. So those types of questions were perhaps not common when I came to China in 2013, but I would say right now that's a lot of the questions that we are seeing and hearing. I'd happily to answer more questions later on, but also know we have a lot of other exciting speakers, so I don't want to take too much time here. So I think I will actually hand over to my colleague here, Judy. You can share your screen. I'll take the chat if any questions later on.
Thank you, Yuan. I believe everyone can see the screen now. My name is Judy Zhao. I'm working for Business Beijing office, and I'll be working a lot with promotional activities focusing on life science and healthcare. And today, we're happy to share some market update in the Chinese market. Yeah, if we move on to the next slide, I'll start my introduction with some high-level data and macro trends. As you can see on this page, by the end of 2022, the number of health institutions in China is about 1.03 million, and with more than 9.7 million patients' beds. And 70% of the patients' beds are at public health institutions. And the number of health consultations in the year 2022 is about 8.4 billion on average, 6 visits per person in China, and more than 80% of such visit is at public health institutions. And in 2022, the national total health cost is more than 8,000 billion RMB, which is equivalent to roughly 7% of GDP of the year, which is lower. However, this is lower than the neighboring countries. In Japan, it's about 10%, and in Korea, it's 9.7%. And in Sweden, the figure in 2022 is 10.7% as well. If we move on, everyone is aware that China is facing a major demographic shift. In the year 2022, after 6 consecutive years of declining birth, China experienced its first decrease in annual population since the early 1960s. The number of new births in the year 2022 was about 9.5 million, with a birth rate of 6.77 per thousand. This figure is even lower than the year before, 2021. And in the meantime, about 49% of China's population is now over 60 years old, over 65 years old, and the prevalence of chronic disease among the elderly is around 78%. So with this is said, as today, China is prioritizing this high quality development, but in the meantime, the country is facing a demographic transition towards an aging society. And in light of these broader trends, we have identified several key trends in the life science and healthcare sector. The first one is innovative medicine. In recent years, China has started to encourage pharmaceutical companies to carry out research and development of innovative drugs. And very recently, about 1 week ago, the central government in China is working on a plan to provide comprehensive support throughout the entire process of development of innovative medicines. And the second trend is volume-based procurement. The objective of volume-based procurement is to significantly lower the price in exchange for large procurement volume. And as we see today, volume-based procurement is increasingly becomes a standard practice and the dominant procurement models for public hospitals in the China market. And the third trend is a focus on the development of primary healthcare services. This is not a new topic. However, we see efforts are made to continuously improving this primary healthcare services and improve its accessibility. And the last one is digitalization. As we see today, digitalization is being utilized to enhance medical services, to optimize the operational efficiencies, and broaden medical services coverage within the health industry. And for today's update, we'll give you a little bit more information on the development of digitalization. If we look at the digitalization in China in the health sector, it's not really a new thing. It started from the 1990s, and we can divide it into 3 development phases. The first phase primarily concentrated on the hospital information systems, and the second phase was marked by the rise of online consultation. And the third phase, as we see today, is featured by the establishment of a comprehensive digital health ecosystem. And the outbreak of COVID, no doubt, is a catalyst for the growth of online consultation and medical e-commerce in the Chinese market. If we move on, we can see that looking ahead, we believe there are several sectors driving the growth of e-health in the Chinese market. For instance, the basic medical insurance program is being extended to online hospitals in a number of cities and provinces. And the utilization of AI and big data will be used for to enhance these diagnostic capabilities. And we also see internet hospitals are helping to reduce the burdens of traditional healthcare facilities. And besides that, on the consumer side, there is a shift in habits from offline to online consultations and procurement of medications. Consequently, as you can see on the chart in the color in this page, the proportion of China's digital health expenditure is in relation to the total health spending is increasing over the years. And in the year 2022, it stood at 5%, and it's projected that by 2025, the proportion will reach more than 10%, roughly about 12%. If we look at the, if we move on to the next slide, and we can see what are the focused areas of the digital health in the Chinese market. We see today there are 5 main areas in this digital health. One is the digitalization for public health. This involves collection, storage, and analysis of public health related data. The purpose is to support in decision making and to improve public health systems. Two is the digital therapy for patients, and this includes online consultation and internet hospitals. And by having this online consultation and internet hospitals, it enables patients to access healthcare services remotely. And the third area is digital management, which means digitalization is utilized as a tool to enhance operational efficiencies as well as to optimize healthcare process. The fourth area we see is digital pharma. Digital pharma enables the comprehensive digitalization and traceability of the entire drug research and development process, also including the drug supervision, clinical use, and the drug market. The last one we see is digital medical insurance. This refers to the integration of digital technologies into the this refers to the integration of digital technologies to improve the efficiency and effectiveness of medical insurance systems and the process and the procedures. And all these focused areas, I would say, collectively contribute to the advancement of digital health in the Chinese market. However, even though this market is keep growing, we still see there are a number of challenges, and continue with the next slide. Talking about challenges, the first challenge is the data inconsistency. For instance, despite the national standards for electronic health records and other health-related systems, the implementation of data standards varies a lot among different medical institutions and different enterprises. And this inconsistency hinders effective data sharing and data usage. In addition, as a world concern, a world question, how to safeguard patient privacy and ensure data security are going concerns in the Chinese market as well. And furthermore, there are restrictions on cross-border data sharing, which limits the exchange of healthcare information between China and the other countries. So with this said, what does this mean to the Swedish companies? Yeah, we see there are opportunities for Swedish companies to explore in this digital health sector. For instance, for companies with innovative technologies, they can further into have a local presence or work with with Chinese partners, and such companies may such companies may have such technologies such as health monitoring device, AI-driven diagnostic solutions, as well as other cutting-edge technologies in the digital sector. And for companies specialized in AI and machine learning, we assume China might be a very suitable market, as the country is also seeking for advanced healthcare solutions. And this is a huge market for AI data and also machine learning resources. And another niche area is the digital solutions for the elder care. As China is getting old, digital solutions related to healthcare and health management may have a market potential in the in the Chinese market. And the last one is about drugs, because as we see today, more and more people are buying drugs online. So for pharmaceutical companies, particularly those ones offer OTCs, may consider to explore opportunities to work with online platforms for some online sales on the retail basis. So this is a very short introduction of the market update. I'll end my introduction with last slide about this life science platform in China. Actually, we have a life science platform in China run for a couple of years, and it's suspended due to the outbreak of COVID. And from 2024, we have decided to resume this platform. And this platform is run by Team Sweden, which means it's run by the embassy, the consulate, as well as Business Sweden. And for us, we have jointly decided to prioritize life science as a platform, promote Swedish innovative solutions, and enforce the presence in the Chinese market. And for more information of this platform, please feel free to contact Business Sweden, and we'll be more than happy to share the planned activities for the year 2024. Thank you.
Thank you, Judy. So, hi everyone. This is Stacy from Business Sweden Hong Kong office. So glad to see you all here. So I work closely with Johan and also Judy in the market here to help with the Swedish company. So with Hong Kong being one of the cities in the south part of China, but is often treated as a separate market under the one country and two systems principles. So just to start with some of the statistics here. So the Hong Kong total health expenditure actually reached over 200 billion in 2020. And then it's actually expected to grow at a CAGR of 6% in the following years, driven by the major public investments by the Hong Kong government. So one of the reasons because we have a serious problem of the aging population. So it's expected that by 2030, around 30% of the population will be at age of 65, above the age of 65. So with the increasing aging populations, that will be having increasing prevalence of the chronic diseases as well. So the numbers, as one of the things we also want to point out here is, as you can see that in the fourth graph here, the private primary healthcare provider is actually increased quite sharply from 2011. So just to mention here that not only the government, but also the private sector is investing into the industry to create a great room for the business growth for the Swedish company. Just to look at a little bit more of their numbers, so how Hong Kong create the business landscape for the healthcare and life science businesses here. So as I mentioned that Hong Kong, we have the longest, we rank the first in the long life expectancy, so that with longer life that we actually increases the demand for healthcare service, like we have more aging people here. The second is also that we also as a leading hub for the healthcare efficiency and also the pharmaceutical hub and also the biotech funding hub in the region here. So we are actually the third pharmaceutical hub in Asia, following India and Japan, and also the second largest bio funding hub in the world, with the access to talent and also capitals. So as mentioned previously, with the lens of opportunity in the healthcare sector, so Business Sweden Hong Kong actually identified the industry to be one of the key focus. So due to several reasons, so one of the first one that is of course the major public investment driven by the Hong Kong government. The Hong Kong government have budget 500 billion Hong Kong dollar for the hospital development plan in order to upgrade the facilities and infrastructures since 2016. So it's actually a 20 years plan. So we still have like 10 years going forward, more than 10 years going forward. So on the right hand side here is just to show a little bit like what are the major investment plan, including building 3 more new hospitals. So 2 of them, they will be starting to plan in 2 years, starting in 2026. And then, of course, we will be also upgrading and expanding the current hospital as well. For the budget speech for this year, that we also point out that there will be $6 billion to subsidize the local university to facilitate collaboration with the international institution to set up like life and health technology researches as well. So This is also like to see that the government is actually being one of the biggest investor and also the healthcare provider in the market. So it actually implies its investment into the market actually implies huge opportunity for the Swiss company. On the other side, that Hong Kong, we have a very simple taxation importation policy. We don't have any tax here. We don't have any registration is needed. Of course, only for pharmaceutical product that registration is needed. But then, like the government is also making the policy to integrate having a policy to integrate into the Greater Bay Area. So, for example, the government is setting up this International Clinical Trial Institute to provide support for clinical trials, which the data may be able to use for registration later on in China. So, this is one of the initiatives the government is trying to drive. There are also some of the policy that already have is that the registration in Hong Kong actually provide you a gateway into the Greater Bay Area selected healthcare institutions. So selling into the one market in Hong Kong, so may actually give you two markets in a sense. Now here we want to look into what are the key trends here. Just to name, there are several areas that have been identified as a market driving force. First one of them being the preventive care, for example, solutions such as diagnostic solution and also screening, X-ray, this kind of solutions with the preventive mindset that have already developed in the populations that actually drive this proactive diagnosis in the populations. So besides the hospital, there are a group of healthcare and body inspections institute or a company in the market. They're actually asking for such advanced solutions. On the other hand, of course, like elderly care is also being one of them because of the aging populations. One of the things also similar to China is that about the digital health. So digital healthcare and lifestyle R&D is also being one of the key point to be promoted by the government. So the government actually have pressure in solving some of the major healthcare issues here. One of them also being the shortage in the manpower for medical staff. So the digital solution that can actually help them to improve the efficiencies will be in demand. So just to mention, like of course there will be more than this, but there will be some of the trends that are more specific for Hong Kong that is raising in the market. For the digital solution, it could be, for example, the government is actually looking into policy to hire overseas medical staff. So however, that language can be one of the barriers into the market. So such solutions could be needed in the market in the future. So one of the aspects of some of the company that may be interested is about the reimbursement in the city. So the inpatient care is actually heavily subsidized and provided by the government. They provide a healthcare, public healthcare to citizens at a super low cost. And of course, we have private providers, but then of course, all the expenses are paid out of the citizens' pockets. But the government actually provide taxations and also the healthcare for the healthcare insurances. And also they provide a voucher for the elderly people. One of the things we also want to point out here is that about the healthcare voucher system for the elderly people, the government is also looking into policy in order to make this voucher to be usable in the Greater Bay Area, so that to facilitating more into the integrations as well. Last, but one of the most important things that we also want to mention here, there has been already 19 institutions in the Greater Bay Area that has been identified for selling upon approval with the registration in Hong Kong. So meaning that in Hong Kong, actually, there are some of the leading distributors that actually covering the regional network can actually help you to guide you the way into the area. So by selling into Hong Kong and registering to Hong Kong, that actually may give you beyond one market. So with the time limited here, I will end my presentation here while giving, this is more like for an update on the market, but we also want to hear some of the hands-on experiences from the market. So we now have a pleasure to invite AstraZeneca, the general manager, Son, to share their experience with us in the Greater Bay Area. Thank you, Son.
Hi, thank you. And hello, everyone. This is Shan from AZ AstraZeneca Hong Kong. And all right, next one. And next slide, please. Yeah, it's my honor today to speak a little bit on our journey in Hong Kong in the past years. And actually, we do found that actually Hong Kong is a really good place for us to run business. So a very quick self-introduction. Actually, I have a scientific education background and have many years of commercial experience, mainly in pharmaceutical industry with multiple national companies. And I started with Hong Kong, I think around 1.5 years ago. And in the past 1 year, actually, we have a lot of talk and collaboration with the different stakeholders in Hong Kong locally. And finally, actually, we come out with some ideas. I think that our ideas and operations still evolving at this moment, but I think that some of the things is quite exciting and I want to share with all of you today. So next one. And very quick, I think that AstraZeneca it's not a new company or new name to everyone, and I think that we all know that actually AstraZeneca is a giant in pharmaceutical industry, and actually our business is going quite well, and also the R&D. Actually, we are also developing a very shining portfolio in the past 5 years, especially focused on some oncology area, and actually we are deliver a lot of a new solution to different disease areas, which is quite broad. Start from some primary care, chronic disease management, start from some maybe diabetes, this kind of a chronic disease, and cover a lot of area like CVRM and respiratory, also have some vaccine, and then oncology is one main area we are focused on at this moment. And actually we also started with a rare disease in 3 years ago. And next. And actually, we are doing with Hong Kong for many years. I would say that actually we start with Hong Kong in 1990, which is around 34 years ago. And luckily, actually, with more than 30 years efforts in this market, actually we climb and grow to be the top 1 pharmaceutical company in Hong Kong locally in last year. And if I look at the business, actually, I would say that it's quite good for last year. Our business growth rate is higher than the industry, which is 18%. And if you look at the past 5 years, our CAGR is also very good and around 15%. So actually, we serve a lot of patients with a severe disease in Hong Kong locally at this moment. I think that is all big. Benefit from the market. I mean that actually for Hong Kong, we do have some unique advantage for healthcare, for pharmaceutical industry, and also with some new opportunity coming up, especially starting around 2 years ago. Next. And yeah, this is our company commitment to Hong Kong locally. Actually, we focus to provide different solutions to patients. Actually, our concept is not only focused to provide some treatment drugs, also to collaborate with partners to develop some disease solution to help the patient to manage the disease. And also we want to contribute to the society and not only develop our business, also to help the city and the market to develop well, especially in our industry, and also commit to our people and sustainability. I think that is also a very important pillar for AstraZeneca, especially in Hong Kong. Next one. So talking about the advantage or opportunities we do identify in this market, I would say that actually echoes to the previous talk, and I think the Hong Kong market has some uniqueness for pharmaceutical. First one is I would say that actually the registration, yes, we do have the registration regulatory requirement for pharmaceutical for drugs, but actually I would say that it is not really complicated, and also have a lot of different approach for the patient to get access to the innovative drugs once they available in any markets all over the world. For example, we have the named patient importation program, which if the drug is available in any markets of the world, actually the patient in Hong Kong can enjoy the treatment. So that kind of the mechanism will make our drugs or innovative solution to get a very easy access to this market. Of course, start from the private setting, but actually I would say that it is a quite good opportunity for us to get some earlier access to of our innovative solution. And so follow one is the advanced medical system. Yes, actually, if we look at the life of the Hong Kong citizen is quite long, right? So I think that behind us is a very good quality of the medical system, and I think that all not all, but majority of the doctors here actually is educated in the US and UK medical education system. So actually they are quite, have the same quality with the Western medical system, so which is quite easy to talk and also easy to collaborate. And also, I think Hong Kong also have some opportunity or some advantage to doing with some R&D. We have very good talents here because we have a very good university and with a very good quality of the young talents here. And also, I think that easier access, I have to talk, for drugs actually, when we apply with some special program, actually the patient can enjoy the advanced treatment at the very first second. And for some medical device or some testing kits, actually, there's quite easy to get access to the private setting. Not only less things, I think that we also have identified some opportunities. I think the stuff from around 2 years ago. First one is we do get a very clear signal that the current Hong Kong government want to support to really incubate or shape the innovation and technology in Hong Kong locally. Before, I think that most of the people talking about financial more, actually not really talking about this kind of innovation or technology thing. But in the past 2 years, I think that the government actually determined to really develop the advantage of the innovation and technology things in Hong Kong. So we can see that a lot of subsidies and a lot of support program to really want to incubate or support some innovation or technology development in Hong Kong. And also, we can see that everyone in this market actually emphasize a lot on the industry, actually, which is not really a key topic before. So we do also see some new scheme to really support this kind of a business running in Hong Kong currently. I think that right stuff from beginning of this year. And also, I think that Hong Kong government also announced that actually they want to continue to improve their regulatory system, especially for the drugs, which they announced that they have the ambition to really establish a primary review, which called Hong Kong FDA. I think that also provides some opportunity, especially in the pharmaceutical industry, to see that how we can get the early access to a market. This is a really exciting news to this industry. I think that in the fourth quarter in last year. Also newly set up the Clinical Research Support Office. I think that was definitely streamline some resources to really push forward the R&D activities in this industry. Next. Yep, so this is our idea we came up last year, and besides a successful business and also a very high growth in this market, actually we are also coming up with some ideas to do more R&D research and development activities in this market. One is to really leverage the subsidies or supports we can get in this market to generate some data, some good evidence, not only benefit this market, but also can benefit more markets. And second is to really bring some good new products to this market. I think that both from the global and also from the China side. And from this medical and R&D center, actually this hub can also help us to really incubate the ecosystem together with our upper and lower side and supplier and also the partners. And also we also announced to set up the iCampus. We call iCampus, which is an incubation center, which we provide a total solution to really help our partners in this ecosystem to grow or to do business in Hong Kong. This is also announced to kick off in the end of last year. And third one is we are also developing a venture capital fund, which we have run in mainland China for previous 3 years, very successful. And actually we want to duplicate another one, which is a US dollar fund in Hong Kong to really help some of the portfolio company and also the potential partners to really landing in Hong Kong and also to invest their future. Yeah, so along with our idea, actually, we bring a lot of our global colleagues and leaders to come to this market and to talk with different stakeholders. And at the end of last year, actually, we successfully announced that we will kick off the R&D hub, and also the to do with iCampus, our incubation centers in Hong Kong locally. But at the same time, I would say that actually, along with a talk with different stakeholders, actually last year when I look at my business, actually we bring more drugs and also the solutions to this market earlier, and also to find out some opportunities to enhance our like early detection, and also some tech into some market which is we are not really covering in the past. So also bring us a lot of business outcome last year. Yeah, and one more thing is on top of the Hong Kong market, actually, we also remember that we talk about the Greater Bay Area, and the area actually is, I think the population is around 10 times size of the Hong Kong size. And actually, we currently have 19 hospitals can get the access to the Hong Kong and Macau registered products. So for this GBA policy, actually, AstraZeneca Hong Kong also have some good case. Currently, we have 3 products has been listed in GBA hospitals, which are located in Guangdong province. So I think not only Hong Kong market actually leverage this policy, we are also tapping into the GBA area to have some patients also and generate some business there. And I think that moving forward, we do see a lot of collaboration between these two sides, especially to discuss how to have the more advanced treatment to serve the patients, and also have the very clear news that actually currently is 19 hospitals and 19 centers, and in the short term they will expand to maybe 50. So actually we are quite exciting to also leverage this policy to benefit more patients and also to enhance our business opportunities. Okay, and I think that this is a final size for my talk, and I would say that actually along with our business growth, and also we are develop the ecosystem together with a local ecosystem partners. Actually, we aim to build Hong Kong as a hub. Together with Shanghai. Shanghai is which was announced as a 5th site, which is outside the only one strategic site outside US and UK, located in China as a strategic site for AstraZeneca globally. And I think that this is also show our ambition and really show the opportunities are behind or in this market. I think this is all I want to share today, and yes, happy to discuss when we have some time or can meet in person. Thanks.
Yep, thank you very much, Son. So we will have we have some time for Q&A, but before that, we also want to present you on the opportunity of the Swedish healthcare delegation to Hong Kong and Shenzhen to let people really know how we can actually, how Business Region can actually support you to access to the market. So basically, we are planning a delegation for the Swedish company at the week of 14th in May. So in mid-May, we have a 3.5-week delegation. So this delegation will include a meeting with government officials, hospital, as well as some of the private as well as to visit to important healthcare events to get an insight and build a network. So within the 3 days that we will have 2 roundtable discussions, primarily one in Shenzhen and one in Hong Kong. So we're inviting the government official to the roundtable discussion to discuss about what are the government policy when it comes to the healthcare. So what are they driving and to clear on the government visions, and what are the regulatory direction that they are actually trying to move, especially when it comes to the Greater Bay Area integration policies. And then we also discuss about the trend and demand in the Greater Bay Area. In Shenzhen, we will be visiting 2 hospitals, and then in Hong Kong, we'll be also visiting some of the private public hospital with a great mix, and also planning to visit a healthcare group with a mix of different stakeholders to really, for the Swedish company to connect with their local stakeholders to really understand about the opportunities and be connected for future collaborations. And of course, we will spare half day to visit of the Hong Kong International Healthcare Week. So just to mention a little bit, this week there will be 2 primarily events under that. So one of them being a Hong Kong Medical and Healthcare Fair. So it's actually one of the leading trade shows in healthcare sector. So that will be gathering a cloud of supplier, product developers and also distributors, so that you actually can go to the event and meet with some of their suppliers there, and maybe potentially to explore some of the collaborations. So here it will be actually the end of our presentation. So thank you very much for all of your time. We will now have the Q&A. So if any of you that is actually interested to know more about the delegation and also the China Science Life Science Platform, please feel free to reach out to me or Judy by the email, so that we are happy to set up a call if needed. But if you're actually interested, please, we will share the invitation after that. We will need to have the invitation signed end of the month. So that will be by 28th of March. Thank you. So,
Great, and thank you all of you who have been presenting. I think we've received a lot of information, and I'm sure there are lots of questions. But if not, I actually thought of some. I was thinking about Judy. You mentioned the opportunities for Swedish healthcare or life science companies in elderly care. Do you have any examples of what that could be? Would it be like assistive devices, or would it be chronic disease management, or what do you think?
I think it would be both. For instance, we have, I believe AstraZeneca has lots of drugs. I mean, for chronic disease management, for instance. We also have Swedish companies, for instance, Bioman, they're providing this hearing aid for elderly people. It's a device. We also see some other applications more for to serve the elderly. I mean, the market is generally big, and I believe there's still opportunities for companies with cutting-edge solutions in the market. Yeah.
And is there a trend to try to have people stay at home as long as possible? I know there are some really nice elderly care homes, but they're super expensive. So how are people thinking about this?
From the government perspective, we still have this 97-3 policy, which means 90% of elderly people are encouraged to stay at home, and 77% to be taken care by the community, and 3% living in the nursing homes. So smart solutions that can be used at homes can be also have an opportunity in the Chinese market, because a large number of the elder people eventually will take care of themselves, or take care of themselves with the aid of others at home. Yeah, so I believe smart solutions for home use can be of interest for the market.
Any other questions? Then I have one also for AstraZeneca regarding the venture fund. Sean, is that what kind of companies is the fund looking to, or what kind of companies are interesting for the fund to support?
Actually, we are quite focused on a pharmaceutical company. Actually, we are leveraging our experience. One is our R&D capability to identify the real cutting edge technology and also solution to the patients. And the other one is leveraging our good experience of commercialization. Actually, we are quite focused on in this industry. I would say that we are an industrial fund, which is just want to invest some of the really good startup company and to help them to really come to the commercial in the future.
But mainly within pharma then?
Yes.
Okay.
I think pharma, yes, I would say the healthcare, and actually half is a drugs and half is a medical device and also some digital solutions.
Okay. So that could be interesting for maybe everyone here. So Don, you have a question, please.
Yeah, hello. Thank you for the presentations. I have a question about the registration of some medical devices and other medical products in Hong Kong, and the use of that registration in the greater area. What's the recommendation there for next steps to understand more about how that one works? And can you give some more information about that one now?
So I would say that in Hong Kong, the policy actually for this policy is actually one of the goal of the delegation. So that currently the medical device is still not mandatory in Hong Kong. So you can still sell to Hong Kong without any regulations. So how the system is actually work here is that first of all, in Hong Kong, you will still need a local partner because there will be a local responsible here that you are needed. So you have to find a distributors. But the registration usually is actually done by the local distributor. So that basically you apply to the medical device controls office in Hong Kong, so that after they actually grant you the approval that you can sell into Hong Kong. But then on the other side, that the distributor can actually help you to apply for application to the Guangdong provinces. That will be they will actually grant you like they will actually review your process, whether they're needed, whether all the institute they actually have the capacity to use their medical server. Of course, there are still some of the criteria they have to review, but that I would say that relatively when you compare to the full application in China, that is more simplified, and they will actually notify you of the result within 20 days. So that is basically how it works. But of course, there is more in details that I'm gonna, because of the time limited, that I'm not able to share too much. But then of course, like more details that we will be of course share in the delegation as well.
Great. Carlo.
Hello everyone. Thanks for a great presentation, and hi Judy as well. Just a quick question on so Carlo Negri from Sweco Architects, so architecture and engineering company from Sweden, and we work in China a lot, designing buildings and engineering. And worked with healthcare and hospital design quite a lot. So I just want to ask a little bit more. There was mention of hospital design and hospital facility design. Just to, if anyone might be able to expand a little bit more on those kind of opportunities, and also how, because in our experience, it was obviously quite a different setup than say Sweden, because you have a lot more people, but rules and regulations are quite different, and the challenges of bringing the quality that we have in healthcare and healthcare design in particular from Sweden to somewhere like China that has a number of other challenges. So I just wondered if maybe someone was able to expand a little bit more on that, if possible.
No one is.
No.
Feels. I guess the construction and building sector has not had a very good development the last few years, but that might be more when it comes to living spaces.
Mm.
Do you know what it looks like for a hospital? Is there a lot of expansion plans, and what sort of level or standards? I guess that's something we'll have to find out.
Yeah.
Or maybe Stacey?
Do you mean like who that you should approach to, or like what is the standard of building the hospitals?
Just more in terms of opportunities for like new hospitals and projects. So there's been a lot of emphasis on the infrastructure and construction and housing, as you said, and models shifting. But I know that when these hospitals are built, they're much more like you build these huge hospitals for 1,000 beds and 2,000 beds. And I just wondered, what those kind of opportunities were, if there's, more.
Do you mean in Hong Kong or in China?
In the Greater Bay Area, Hong Kong.
Hong Kong, that we actually for the coming years that we have planned to have 2 more new hospitals. And then of course there will be 17 expansion and upgrade of the existing hospitals. But then like for the Greater Bay Area, of course there are too many like projects going on in regions that probably I have to get back to you later on. But then like when it comes to that, do you have any specific more like what are they asking? What, like for example that except for the new projects, or what is there any specific that you want to know about, like in the projects?
Well, maybe I can just contact you separately and we can talk about it. Yeah. Okay. No worries.
Yeah. Yeah, Carlo, I could mention that for many provinces now at the beginning of the year, they also issued the key projects in the province. In the provincial level, there are some hospital plans. For instance, in a number of provinces give the key projects to be started from 2024, and some of the province projects including new hospitals. Yeah,
Right.
This is a source to fund new potential projects as well.
Okay. Thank you.
Thank you. So no more questions, and we're already past 10. So unless someone, there's a last chance for a question, but if not, yeah. Thank you so much for presentations with a lot of information, and I think I'm allowed to share the presentation in PDF format with everyone. So maybe you can go back and look at the figures and all the information that we didn't really have time to go deeper into today. And yeah, as Stacey said, please contact her or Judy for the more information on the delegation trip. And Swecare will also share that the invitation. Okay, but any last comments from our presenters? Okay, but thank you very much. And
Thank you very much.
Yep. Hope you enjoyed and felt that it was a valuable time for all of you. Okay, bye-bye.
Thank you for listening. Let us know if questions. Bye.
Thank you. Bye-bye.
Thank you.